Another objection is, why can't we do the intervention ourselves, or the DIY intervention? And why this one's scary is this one is the one I call the silent killer. And the reason I call it that is because some families will bring it up, but a lot of families will not go ahead and tell us that they're going to do it themselves, because after hearing what we have to say, they realize what a horrible idea it is. I mean, doing an intervention yourself is like representing yourself in a major court appearance. You know, doing an intervention yourself is like doing your taxes by somebody who absolutely has no idea how to do their taxes. Doing an intervention yourself is like trying to take on any other trade that you have absolutely no clue as to how to do that trade. And I think the disconnect is families think they could do the intervention themselves because often the hero brother, the oldest child in the family, not always but often, is going to be the guy to come in and give the speech, either that guy or dad. And they're going to talk their loved one into treatment. And guys, interventions are not an event where you talk somebody into treatment. That's a 12-step call that is a free service offered by members of your local 12-step meeting halls. An intervention is about a professional helping you guys understand where you're at, how you got here, how your family roles have affected the outcomes, how those family roles need to change, the psychoeducation of addiction and mental health, the manipulations. I mean, the list goes on. I mean, this is a 3-day process that families call our office and tell us they're going to do themselves in 15 minutes. And I can't tell you how many families have called us, hired us after the fact because they're DIY bombed, or called to rub it in our face that their loved one said yes to treatment. And we'll say, well, where are they? Well, they're still here. Why aren't they in treatment? Well, they said they were going to go on Monday. Follow up next week, they never take the call again. They never went. And the point is that even if you did pull off what we think is the impossible, you trying to do our job, and your loved one went to treatment for 90 days out of state and they did well, it still doesn't change your family system that's broken and the dysfunction that was a large contributor to this problem. So what happens then is, there you go thinking you just did our job, you were successful, they went to treatment, they're doing great, and more happier I could not be. But then they come home to that same family dysfunction, and I've been doing this so long to know that you suck them back in, and they eventually relapse. The chances of your loved one going to treatment, doing everything they're supposed to do, and then knowing how to detach from their dysfunctional family, or the family actually getting better and that coming back as a cohesive unit without professional help, is very, very rare, if not impossible. So just remember, when you guys say you're going to do the intervention yourself, I'll give you that, but please don't use the word intervention in vain, because you're not doing an intervention yourself. You're just going to go give a speech. Don't forget the difference, please.